In this video, we will be discussing about lead toxicity, the important MCQs and one-liners that can be asked from these topics we will be discussing in this video. First, the root of toxicity. In children, the lead toxicity is due to ingestion, and in adults, the root of intake of lead is by inhalation. And this chronic lead poisoning can be also called as plumbism, saturnism, or Miner's disease. These are the other names. Then the mechanism of action. What all are the enzymes that is inhibited in lead toxicity? One is ALA dehydratase, coproporphyrinogen oxidase, and ferrochelatase. Next, the clinical features. Clinical features of lead toxicity can be studied under A, B, C, D, E, F, and G. A stands for anemia, which is circumoral pallor. This is the first feature. This is circumoral pallor, first feature. Then basophilic stippling of RBC. It is due to the inhibition of enzyme 5-pyrimidine nucleotidase enzyme, which is also a MCQ previous year question. And another B for Burtonian line, which are blue lines on the gums, but it is not specific for lead toxicity. This can also be seen in mercury and copper toxicity. Then before bone line. Bone line means we take X-ray of a chronic lead toxic patient, we can see calcium deposits at the metaphysis. This bone line is not due to lead deposit, it is due to calcium deposit. This is a previous year question, which is an image based question. Then C for colic pain and constipation. D for two drops, it is wrist drop and foot drop, which are pure motor neuropathies. E stands for lead encephalopathy and F stands for fertility related issues like abortion, impotency, and sterility, and G stands for Saturnian gout. For diagnosis, for screening we will take urine sample. In urine there is elevated ALA and coproporphyrin, and the best test is whole blood lead level, which is greater than 10 microgram per 100 ml. And for management, for conscious patients or with mild symptoms, we have to give oral DMSA. For unconscious patients with severe symptoms, we have to give IV EDTA. For lead encephalopathy, we have to first give IM BAL, then followed by IV EDTA. BAL is also called dimercaprol.